At least 136 deaths in Eastern Democratic Republic of Congo are now suspected to be linked to a fast-growing Ebola outbreak. This as officials confront the Bundibugyo strain of the virus that spread silently for weeks before being detected. The virus has already crossed borders into neighbouring Uganda, where 2 confirmed cases, including 1 death, have been reported. The World Health Organization has declared the outbreak a global public health emergency, warning that the situation is evolving quickly.
And because I'm deeply concerned about the scale and the speed of the epidemic, we will convene the emergency committee today to advise us on temporary recommendations.
Officials warn it could take months before any vaccine targeting this rare strain is approved and available for use. As of now, the WHO has deployed experts, tents, infection control kits, and emergency medical supplies into affected areas. US Secretary of State Marco Rubio said the WHO was a little late to identify the outbreak, while the organization stresses on the challenges of operating in conflict zones with limited access and weak health infrastructure due to steep funding cuts. Treatment centers in Congo are already under pressure, with some hospitals in eastern Congo full of suspected Ebola patients and struggling to isolate new arrivals. Officials fear the risk of burying victims without proper protective equipment.
We need funerals which, in the past, used to be held with the whole family, but now, unfortunately, we have to adopt a different way of burying the bodies, because it is often, as you've heard, it is often during funerals, when families gather, that infections spread.
The outbreak began in eastern Congo's Ituri province, a densely populated gold mining region near the borders of Uganda and South Sudan. The Congolese are now seen wearing face masks again, fearing a repeat of past Ebola crises that devastated communities.
One person infected with Ebola can infect more than 5 people. It's very dangerous. We are truly afraid of this disease.
Meanwhile, neighbouring countries have increased border monitoring and health screening, with Rwanda even closing down the Goma border crossing. Other countries have also stepped up airport screening and visa restrictions for travellers linked to outbreak-hit regions.